According to the Center for Disease Control and Prevention, 1 out of 3 people are addicted to some kind of pharmaceutical. Prescription drugs are now responsible for more overdose deaths across the nation than street drugs such as cocaine, heroin, and meth. In 2009, in Clark County, Nevada alone, 304 deaths were directly attributed to prescription narcotics. Statistics show that each day in the United States, 2,500 teens abuse prescription drugs for the first time, and the number of emergency room visits is up 97%. Painkillers such as roxicodone, Lortabs, Oxycontin, Vicodin, Percocets are usually prescribed by doctors for a variety of ailments for the temporary relief of pain and are not intended for long-term use. Long-term use of painkillers causes the brain to stop production of endorphins, which is the body's natural painkiller. That's why the abusers become addicted or hooked. The abuse of painkillers can cause respiratory depression, constipation, papillary constriction, reduction in blood pressure and heart rate, coma, and death. Heroin, also known as black tar, white girl, smack, jump, H. Heroin causes the user to experience euphoric feelings caused by this drug halting the production of the body's natural reward feelings. After time, the body stops the natural production of these feelings, and the abuser cannot feel any good feelings without the use of the drug. In fact, when the user stops taking heroin, the body is at a loss, and negative symptoms occur, including seizures, severe cramps, coma, and eventually death. MDMA, or ecstasy, is a psychoactive stimulant taken orally as a capsule or tablet. Ecstasy causes feelings of mental stimulation, emotional warmth, enhanced sensory perception, and increased physical energy. The younger generation has turned to ecstasy as the party drug of choice because it allows users to dance for extended periods of time. Getting high on ecstasy can lead you to do things that you normally wouldn't, such as risky, unprotected sex or taking other unwise chances. Those who overdose usually experience overheating, panic attacks, faintness, severe dehydration, and loss of consciousness. Ecstasy raises your body temperature and makes you restless, so you have to keep moving, and you are literally overheat and cook your inside. Some people who have died from ecstasy have had a body temperature of over 108 degrees. Alcohol, booze, liquor. People use alcohol for various reasons. Some people use it as a form of stress relief, as a way to escape their problems, or to fit in social situations. Many alcohol users start out as teenagers due to peer pressure. Alcohol affects people in various ways. It can cause people to shed their inhibitions, leading to promiscuous behavior, such as having multiple sex partners, leading to increased risk of sexually transmitted diseases and unwanted pregnancy. Some people become more violent. Some people experience a decrease in mental alertness when drinking alcohol, causing them to make poor decisions. It also affects the memory. Alcohol abuse increases the risk of various health conditions, such as heart and liver disease. Alcohol works on the central nervous system, impairing brain function. Over time, alcohol consumption can destroy brain cells, resulting in various degrees of brain damage, even death. Methamphetamine, the devil's candy, also known as speed, meth, ice, crystal, crank, and glass. It is estimated that nearly 25 million people worldwide have tried methamphetamines, making it the most used illicit drug next to marijuana. Crystal meth is often preferred over cocaine because it has a longer duration of action and can keep the user high for up to 12 hours. Meth users often do not eat. They clench their jaws and grind their teeth from the effects of the drug. They do not brush their teeth due to their altered state. This can lead to advanced tooth decay, also known as meth mouth. Other negative effects of meth include seizures, stroke, depression, chronic fatigue, and death. The drug affects the central nervous system and causes liver and kidney damage, psychosis, paranoia, anxiety, and an all-over body itch that some users say feels like little bugs trapped under the skin. In some extreme cases, the skin is scratched open to reveal the bugs. Once addicted to meth, successful rehabilitation for users is extremely rare. Treatment is difficult because there is currently no known effective medication, and behavioral and cognitive approaches have not shown long-term benefits. Death is far more likely to be the end result.